My role at the University of Michigan is serving as the director of the Institute for Healthcare Policy and Innovation. The Institute is a new organization at the University of Michigan that includes 400 faculty members from 12 schools and colleges on campus, as well as 5 local research organizations that have partnered with us at the university. I'm a physician by training, a primary care physician in internal medicine. I love taking care of patients, but oftentimes when we take care of patients one at a time, we see some of the more challenging problems in terms of the social determinants of their health, as well as the way our healthcare system functions, for better or worse. And so those insights that came from my clinical practice, taking care of patients, really motivated me to seek additional training in what we call health services research and health policy, trying to understand how the healthcare system functions in terms of access to care, quality of care, costs of care, and how we can improve it for large numbers of patients and for the population as a whole. My work focuses primarily on access to care and quality of care, and particularly on healthcare disparities, understanding why some patients are treated differently in our healthcare system. I've been very interested in studying how race and ethnicity, or socioeconomic factors, or insurance coverage and gender, how those social characteristics of patients influence the way that their health develops, the way illness is experienced by them, and most importantly, how they're treated by the healthcare system. We have a large project where we'll be evaluating the expansion of Medicaid within the state of Michigan, what's called the Healthy Michigan Plan. I'm leading that project, which we'll be conducting over the next 5 years, to understand what impact expanding health insurance coverage to low-income adults has on their use of services, their connections with healthcare providers, and their health outcomes, as well as the costs of the program and the ways that financial incentives can be used to improve people's choices about their health behaviors and their health services. We've got challenges in many domains. We've got costs of care that are really increasing at a rate that's not sustainable, either for individuals and families or for society. We've got problems with quality of care. When American health care is at its best, it's among the best in the world, but too often it's uneven, it's fragmented, care is not well coordinated. Patients with lower incomes or those who are uninsured or immigrants or from minority backgrounds are often not treated as well as those from more affluent or advantaged backgrounds. So I think understanding how we get the most value for the healthcare dollars that we're spending, as well as how we provide healthcare in the most equitable way, are some of the most important challenges that we face today. The Institute for Healthcare Policy and Innovation is an effort by the University of Michigan to bring faculty together from many different backgrounds. We have 3 main functions that are very important to the success of the Institute. The first is promoting better collaboration between faculty and students in different areas of expertise. The second is producing high-quality evidence with the best possible methods about what works in healthcare, what we can do better. And then third is communicating our results more effectively so that we can have a greater impact, so that we're not just writing for our colleagues at other universities, but we're actually communicating results to leaders in healthcare, to policymakers in state and federal government, to members of the public who need to make important healthcare decisions for themselves and their families. I came to the University of Michigan to lead the Institute for Healthcare Policy and Innovation from Harvard. I had been happily on faculty there for over 20 years and really enjoyed my work there. But I saw that Michigan had a blueprint, had a plan for something new and exciting. This is something that I think most leading research universities in the U.S. and around the world should be striving for. And I was very impressed that Michigan was taking the lead with this new approach to solving some of our toughest healthcare problems. I think we're in a time of great change. The healthcare system is unsettled. We've had a very reactive system for many years in the U.S. where we do a good job taking care of people after they're sick, but I think we could do much better trying to keep people healthy, identifying chronic conditions early after they develop, and then managing those conditions more effectively to prevent the complications that can really take a major toll on people's health. IHPI is bringing together some of the brightest minds that we have at the University of Michigan to work in new ways, giving them resources and access to data. That's how we can have an impact both in the present with the work that we're doing, as well as by training the next generation of leaders in our field.